Hi, this is Emily Newman. I'm giving you my case analysis of Virginia Woolf with the movie The Hours for assignment 6. So, Virginia Woolf once wrote, "Someone has to die so that the rest of us should value life more." Thinking as a therapist, I think that it's an interesting insight into the life of what someone battling depression is thinking. Prior to this assignment, for previous school assignments, I had read Virginia Woolf's novels, and I wasn't aware of the mental health conditions that she was facing or that she ended up taking her own life at the age of 59. After researching Virginia's life, her decrease in emotional stability eventually began after her mother passed away at the early age of 13. Shortly after, her sister passed away as well. Despite her talented writing abilities, Virginia is best known for dealing with depression, mood swings, and suicidal thoughts. Her life is depicted in the movie The Hours, starring Nicole Kidman as Virginia herself. In the movie, it was helpful to see what inner turmoil someone with depression and bipolar disorder lives with on a daily basis. This is also shown by following the lives of 3 women who are also suffering all different versions of depression, similar to Virginia Woolf. Next, after consulting the DSM-5, I was thinking about what I would diagnose Virginia Woolf with. My initial diagnosis for Virginia is major depressive disorder. The base symptoms of major depressive disorder are depressed mood or loss of interest or pleasure. It was evident that Virginia had a melancholy and depressed demeanor at all times, and was reported that she spent much of her time alone and secluded in her room or sleeping. This is seen throughout the whole movie, that she looks lost and anxious. In the movie, we see an anxious woman who smokes cigarettes in her room alone, fighting feelings of loneliness and discomfort in her own skin. Another symptom from the DSM-5 criteria of major depressive disorder that Virginia displayed was significant weight loss and decrease in appetite. Early on in the movie, her husband chides her for lying about eating breakfast when she didn't, and not following the doctor's orders to eat a hearty breakfast and lunch. It also shows that the cooks and servants complained about Virginia being a difficult eater and not partaking in the food that was cooked for her. Lastly, her lack of nutrition is pretty evident when Virginia gets stressed, and she appears frail and physically unhealthy due to the lack of sustenance and lack of her desire to eat. Virginia, as well as the other females in the Hours, all showed signs of insomnia and lack of being able to sleep. She is shown staying awake late into the night in her writing chair upstairs alone. She looks mentally and physically exhausted. I would also associate this symptom, the opposite of insomnia, to hypersomnia, because in her biography, she is said to have spent 2 consistent months sleeping in bed, not leaving her room. In the movie, she often displayed symptoms, as stated in the DSM-5 for major depressive disorder, of fatigue and loss of energy. She never seemed to amount to much in one day, other than sitting upstairs in her room, writing and smoking cigarettes. The DSM-5 also states that patients diagnosed with major depressive disorder experience feelings of worthlessness, excessive guilt, and recurrent thoughts of death. Virginia's suicide ideations are initially vocalized through the novel she writes, but ultimately end up in her own life. Virginia also displays symptoms of lack of social functioning. This was visibly noticeable and impaired during her interactions with her sister Vanessa and Vanessa's children. She placed a large amount of pressure on her sister to include her in everyday activities, like inviting her to a luncheon in London. But her antisocial behavior was off-putting to strangers, as well as Vanessa's children, who seemed to sense that something was off. For example, she one-sidedly kissed her sister Vanessa passionately on the mouth, ending a visit uncomfortably. She was also short-tempered and demanding with the servants, asking them to go on incredulous errands without any consideration of social graces. This was evident when she asked her servant, the cook, to go to London on the train to get ginger for her sister's children, but there really wasn't any reason to. Her insistency shows that her social functioning was definitely impaired. It's also important to mention that the DSM-5 attributes these symptoms to significant loss, bereavement, intense sadness. These could mistakenly resemble major depressive disorder. However, Virginia's symptoms have persisted all throughout her life, and I still consider my initial diagnosis accurate. Had these symptoms only occurred for a year or two, maybe I would consider significant loss or an intense sadness a cause for her depression, but because they persisted since the early age of 13, I can still consider it major depressive disorder. The DSM-5 suggests that this diagnosis could also resemble aspects of schizophrenia. Her reported voices inside her head is one of the symptoms of schizophrenia, but I would conclude that she does not meet enough of the criteria to substantiate a true diagnosis. She never alluded to hallucinating images, nor did she have violent and angry outbursts. However, she did hear voices in her head that ultimately and fortunately gave life to the novels that she wrote. Then, to consider all options and reference a differential diagnosis from the DSM-5, I think it's important to note that her depression could possibly be related to another underlying medical condition that's not yet discovered. We would have no way of knowing that, though. She is said to have, in the movie, she is said to have suffered from moods, blackouts, and lack of desire to live. Also, medication could possibly be a reason that would associate these symptoms. They also mirror major depression disorder, as well as this disease could also be related to attention deficit disorder and hyperactivity disorder, as they have some of the same symptoms. However, depressed mood and simply periods of sadness as part of the life cycle don't seem to run parallel to the diagnosis that I thought. All these reasons are possible to potentially rule out my diagnosis. Many of them are not applicable, nor do they apply to Virginia's specific situation. Virginia was not forthcoming on taking any extra medication that may have caused such symptoms. She didn't resemble any symptoms of ADD, attention deficit disorder, and did not appear to have trouble focusing on one individual task, as she was often shown writing her novel upstairs for hours and days at a time. I think the severity of her symptoms and desire for death was far greater than what would be normal for periods of sadness in the life cycle. People experiencing sadness in the life cycle aren't normally depressed for 20 years and have thoughts of death and ideations of suicide. I understand the benefit of keeping in mind reasonable doubt and a differential diagnosis to allow room for other potential discoveries to be made, but I still stand firm that major depressive disorder still fits all of the criteria that Virginia Woolf depicted in the movie. Lastly, I have narrowed down potential treatments Virginia Woolf could have benefited from had she not taken her own life at the age of 59. The first would be psychopharmacological treatments. I researched a variety of options, but nothing truly promised that it would be 100% effective, as it looked like they were still doing research on that. Most psychopharmacological pharmacological treatments are targeted to reduce suicide risk rather than overall depression and just improvement of mood. However, over the past several years, there has been research and evidence that the drug lithium has been proven to reduce the effects of bipolar disorder, as Virginia is reported having. It has also been proven to reduce suicidal behavior, which was my initial target in looking for a drug that would help Virginia. It also covers a range of major mood disorders and a mix of major depression disorders. The side effects and drawbacks of lithium, when taken in excess, could cause death. I think this is potentially dangerous to provide a suicidal, at-risk individual with a lethal dose of medicine that would kill themselves. In addition to this drug must be taken long-term and does not initially cure the disorder, but simply manages it. So a firm medication monitoring is required when taking this drug, or you go right back to where you started. Those were the complaints that I read about the drug. Other possible side effects include sleepiness, weight gain, sexual dysfunction, dry mouth, and blurred vision. To go a completely different avenue, I also considered psychological treatments for Virginia and settled on classic cognitive-based therapy model. The focus of these sessions would be primarily on improving the client's condition by changing the patient's learned behaviors. Doing this, we would eliminate certain aspects of the client's life while emphasizing certain parts of the client's life that are working and then evaluating the effects. Usually, the therapist will meet with the client 10 to 12 times to achieve the full round of this treatment. For example, implementing cognitive-based therapy in Virginia's life. Virginia and her sister seemed that Virginia's sister visiting her and her children seemed to cause Virginia undue stress and anxiety surrounding their visits. So possibly we would refrain from Virginia seeing them for a month to see if the anxiety decreases and the comfort level rises. We would then evaluate the effects at the end of the month. Virginia also appears to be most at ease when composing a novel, lost in her world of characters. So, in order to emphasize something that's making her feel comfortable and something that's working, thus increasing her writing time and directing more focus on her writing, might block out triggers that make her feel sad or bring on suicidal thoughts. Some cognitive-based therapies have been reported to be more successful than medication, but also some have been reported to be ineffective. Cognitive-based therapy has limitations as well as drawbacks. Cognitive-based therapy might not work if the client has an internal chemical imbalance that can simply not be improved by therapy alone. This, I feel, is the case with Virginia. In Virginia's case, while I recognize that therapy would better her, I kind of doubt that it would be enough to dissuade her from ultimately committing suicide with cognitive-based therapy alone. Third, I considered the idea of family therapy as a possible treatment option for Virginia because it's important to include her husband as part of the healing process, as it would alleviate some of the tension placed on him caring for someone dealing with such stressful symptoms. To begin with, I would offer psychoeducation for both her husband and her sister, and possibly her sister's children, on major depressive disorder, and specifically symptoms to look out for, causes for concern, and maybe to show them how to handle a short risk assessment checklist to check if Virginia is in immediate danger or a suicidal risk to herself. I would also educate her family on the benefits of antidepressant medication and also the risks that I mentioned earlier, the possible lethal dose of medicine that would be easily within her reach. They are the ones who would be watching out for her, so it's important that the psychoeducation supports them as well as supports her. Lastly, I would give each family member the opportunity in a safe environment to direct a message towards Virginia expressing their concerns and their desires to encourage her eternal will to live. In the movie The Hours, the husband's frustrated plea while sitting with her at the train station after Virginia escaped their safe haven and him begging her to choose life showed that she was deeply affected by the love her husband showed her. As a family therapist, I hope that the concern her family shows her inspires her to follow treatment instructions. The drawback to this intervention is that it requires cooperation from family members who might also be struggling with dealing with their family member's illness. In this case, I question whether or not the sister and her children would be cooperative and would make the effort to come from London for therapy. In addition to this, there's also conflicting concerns about the effectiveness of just this intervention alone. Again, I would pair this intervention with a pharmacological treatment such as tricyclic antidepressants or lithium. Lastly, biomedical treatments is a possible option for Virginia, but according to my research, this type of treatment is usually reserved as the last resort due to the severity of the therapy. ECT, or electroconvulsive treatment, is designed for major and very severe cases of depression, as it administers low doses of electric shock to the patient's brain while the patient is mildly under sedation. Ironically, this treatment existed during Virginia's time period, but it was a much more violent and archaic version. At times, it would even physically hurt the patient and leave them in worse shape than before. Today, the treatment has been toned down to target symptoms like major depression, sleep and eating disorders, and delusions. It has the effectiveness percentage of 60% to 90% improvement in its patients and is pretty rapid with its success. The drawbacks to this intervention are the severity and unpredictability of the treatment's reaction to the client. I don't think I would consider this treatment without confirmation from several other therapists that it would best serve the client because this treatment makes me nervous. Overall, the interventions I propose that would best help Virginia's particular situation would be the psychopharmacological treatment and medication, as well as either the psychological cognitive-based therapeutic model, but I also think family therapy would benefit the whole situation as well, maybe a combination of those three. I truly believe that Virginia's suicide might have been preventable had she taken antidepressants that I mentioned and received weekly therapy to monitor her mood swings and depression, as well as her suicidal ideations. I think the burden of her care was placed on her husband, and I think that possibly if a therapist had intervened, there is more of a chance for her to live. I also think family therapy would have been a great benefit for her husband because he dedicated his life to supporting Virginia's well-being. As a potential therapist looking at this case, I still feel confident, even though there are still differential diagnoses, that after reviewing all the criteria in the DSM-5 for major depressive disorder and closely examining the symptoms that Virginia Woolf suffered, both in biographies and after watching The Hours, that she still suffered from major depression disorder. That is my case analysis and diagnosis for Virginia Woolf. I attached my references in an additional document, and thank you for watching.